Hi, and welcome back to the Dr. Ramsey Show. There was an article that came out 2 days ago in the Wall Street Journal that I wanted to share with you. They're basically talking about women, depression, and hormones, which I thought was fascinating. That hormones are really getting a lot of media lately. So this article said that about 1 in 5 women ages 40 to 59 and 1 in 4 women over 60 are using antidepressants now, up from before COVID. Many researchers are alarmed at how high depression rates are among midlife women. Even before the pandemic, now, over the past 2 years, we've had exacerbated mental health issues for many Americans. And they went on to say some doctors are also concerned that antidepressants are being overprescribed for menopausal symptoms. And I've seen this since COVID has hit. Even my patients who work in mental health are struggling the most that they've ever struggled before. And so, yes, more antidepressants are being prescribed. I'm seeing that as well. In general, women have higher rates of depression than men. That's true throughout much of their lives, according to scientific research. In midlife, the risk is greater during the years leading up to menopause and right after. The dramatic fluctuations in hormones that cause the most commonly known symptoms of hot flashes, night sweats can wreak havoc on mood also. Estrogen and progesterone are fluctuating a great deal. Those shifts can be hard for the brain to take. And what's interesting is in women who are menstruating regularly, the first half of their cycle is high estrogen. The second half of their cycle is high progesterone. And when women don't make a lot of progesterone, that's where their hormones become moody, angry, irritable easily. That's a premenstrual syndrome or PMS time. When we give women progesterone, the PMS time tends to go away, which is really nice. However, this article is focusing on a different hormone, which is talking about estrogen instead. So new treatments for depression in midlife women may be on the horizon, scientists at the National Institute of Mental Health say. For example, they're studying a medication that acts on estrogen receptors in the brain. The hope is that unlike typical antidepressants, it will directly target deep depression symptoms related to estrogen withdrawal, but without the side effects of traditional hormone therapy commonly used for menopause. Well, my question is, why wouldn't we use the cause of depression in this situation is lack of estrogen, lack of estradiol. We give estradiol back to women when we can't make it anymore, and it significantly improves mood, except they're using a medication that stimulates the estrogen receptor that's not estrogen. It reminds me of the drugs that are used to create, quote, strong bones. They're not strong bones at all. The biphosphonate drugs are used to stimulate bone turnover. Well, estrogen does that. And just because we can't make it at 50 doesn't mean we shouldn't take it. Why would we take a drug that might be similar or stimulates a receptor maybe the same way to make us feel a certain way? I'd rather give the real thing. The same thing with bones. Like, why would I give a drug to create strong bones that really aren't strong bones when I can give estrogen and reduce the fracture rate significantly? So, I think it's interesting they're talking about hormones, especially specifically estrogen. Studies have found that women's risk of having an episode of major depression is 2 to 4 times higher around menopause than other times during their lives. Menopause is defined as 1 year without a menstrual cycle and an FSH above 50. Doctors also note that midlife is often a time of marked stress in women, and stress can increase the risk of depression. We know that. Women may be more likely to seek care for a mental health problem than men. So maybe the statistics are skewed because men will seek it out compared to women. Women will seek it out compared to men. And then research who have been following 90 women since 1988 have found that the incidence of women's midlife depression is concentrated the 2 years before and after the last menstrual period. So right after they go into menopause, now we do not have estrogen made. It's not stimulating our receptors anymore. We tend to get depressed and anxious. There's this one line I wanted to read you. The last line, I made it purple, so let me see if I can see it. Still, many women and doctors are looking for alternatives. People are so deathly afraid of prescribing hormones. I don't know why. It's the safest thing we have. There's no risk associated. Yes, there are side effects, but they're minor and they go away if we treat them appropriately. So we replace hormones to prevent depression in the aging years, to prevent osteoporosis in the aging years, to prevent memory loss, to prevent dementia, to prevent heart disease, to prevent colon cancer, to prevent breast cancer, to prevent prostate cancer. These hormones are amazing. Our patients feel great. They're not chemicals that are like something else trying to stimulate something. We're using the real deal. And guess what? We don't see depression that much in our patients. And oftentimes we can get off our antidepressant drugs with the right hormones. Estradiol, thyroid, and testosterone are all antidepressant hormones, along with one more, hormone D3. So thank you for listening. And I hope that wasn't too much. I'm excited about what the news is talking about. Not exactly my medicine, but similar. And hopefully one day we can all get on the same page and make hormone replacement therapy the medicine of aging people. Have a nice day. Bye-bye.